Okay, well that's great information. I'm glad to see that the majority of you do have written intake protocols. Perhaps a better question is, do you know where they are, and do your staff members know where they are and what they say? So that's an important component of that as well, but the first step is definitely there. And as I said before, for those of you that do have protocols, hopefully it'll give you some ideas of where you might tweak them to make them a little bit better. And for those of you that don't, hopefully this can serve as an outline for how you might go about creating a protocol. So we'll talk for a minute about why do we actually need to have written intake protocols. And the first of many reasons, which I've just put a few up here on this slide, the first is for problem prevention. So problems that I'm talking about could be operational problems, people not knowing what the next step is when an animal comes into the facility. We could be preventing medical problems, so we're going to talk about vaccination and deworming and things like that later on, so we're going to prevent infectious diseases. We could be talking about problem prevention for behavioral problems. And we really focus on prevention because prevention is easier than troubleshooting problems or treating problems once they've already occurred. Not to mention it's much kinder to your staff members and to your animals if you can prevent problems from happening. The next reason is for consistency. So we want to be sure that you know what's happening to every animal when it comes into the facility and that the same thing is happening to animals as they go through. You want to have accountability, so we're going to talk about which staff members are performing which duties as they relate to intake planning. So you want to know if something got missed, why did it get missed? And was it, is there something that we need to do to retrain an individual or a group of individuals to be sure that things are happening the way that we intend them to? And then, of course, you want to minimize stress. And again, this is both animal stress as well as stress on the staff members that are performing all these procedures. If people have a plan and know what to do, it's going to be a lot less stressful than if there's sort of chaos and nobody knows what the next step is. And the bottom line is that having good sound intake protocols really are going to ensure the health and welfare of both individual animals in the shelter and the entire population as a whole. So who is involved in carrying out the intake protocols? Well, it's everybody. Everybody has an important role to play. So you have a few of the key groups of people that are frequently involved in intake of animals listed on this slide here. So you might have receptionists who are interacting with the public when an animal comes in through the front door. You have your animal welfare officers who are picking up animals in the field and interacting with people out in the field. You have the animal husbandry staff and the veterinary team. These are the people who most places typically think of the ones actually performing intake treatments, but they don't necessarily have to be those the only people that are doing those. And I'm going to talk about a variety of things and procedures that you want to do tonight during intake. And really, unless there are specific laws relating to who can and can't perform medical treatment of shelter animals in your area, almost none of the things that I'm going to talk about require any kind of advanced training to carry out. Of course, they've got to have some sort of training. Ideally, you're going to create these protocols in consultation with your veterinarian, and there will be ongoing assessment of people's ability to carry out these things the way that you want them to. But there's nothing here that anybody who is used to handling animals can't learn how to do. So to start out, I would like to introduce this topic known as pathway planning, and this is something that actually starts at intake, and so it's going to set a little bit of a foundation for some of the things that we're going to talk about to follow. And what pathway planning is it's a proactive approach to animal disposition. So what that means is that when an animal comes into the shelter, in most cases, you have a good idea of what the animal's most likely outcome is going to be, and so we want to get them there as efficiently as possible. So for example, if a cat comes into the shelter with collar and tags on, of course that's a really rare occurrence, so you should be celebrating that. You know that that's a cat that you're going to want to try to get it returned to its owner right away. So we can take certain steps to be sure that it gets returned to its owner as quickly as possible. Another example might be a purebred dog that comes into the shelter. You might have a particular breed rescue in your area that you work with and you know really well, and if a breed comes in that fits in that group's work, then you want to give them a call and have that pathway defined ahead of time. And so these pathways are defined at intake, but they're reviewed daily and they can change periodically throughout an animal's stay. And so most commonly, the pathways that we're talking about are animals getting returned to owner, animals getting transferred to other rescue groups in the region, animals getting adopted directly from the facility, and in some cases animals being euthanized for severe medical or behavioral illnesses. And so I put a couple of ideas up on those slides of things that you might want to think about in order to get animals to those particular pathways as efficiently as possible. And the only one that we're going to talk about in detail tonight is microchip scanning.